Well, have you ever waited a long time to see a specialist? Well, new figures have revealed some Australians are waiting more than 6 years to see specialists such as neurologists in parts of the country. National Health reporter Stephanie Dalzell joins me now for more. Steph, I know that you've dug into these numbers and had a look across the country. Can you tell us a little bit more about the figures?
Yes, the ABC has analysed the available data to determine some of the longest waiting times for public specialists across the nation, with the results being described as heartbreaking and offensive by doctors. In South Australia, some people are waiting more than 6 years to see specialists like neurologists. In Tasmania, some are waiting more than 5 years to see paediatric allergy and respiratory specialists. Also notably in Tasmania, some people are waiting more than 3.5 years for urgent appointments with brain surgeons. An urgent appointment, the clinically recommended timeframe is within 30 days. These people are waiting more than 3.5 years. In Victoria, some people are waiting more than 3.7 years to see ear, nose and throat surgeons. Clinical Professor of Medicine Graham Stewart says much more needs to be done to address this issue. Take a listen.
Well, as a clinician, I'm deeply offended by it. Each statistic is a person who's waiting for essential care way beyond the time that is clinically appropriate, and that carries with it the risk of preventable death.
So, Steph, what about the other states? What are the waiting times for somewhere such as New South Wales?
Well, getting a true idea of the extent of the problem is really difficult. The states all collate the data differently and only some routinely publish it. So New South Wales, Western Australia and the Northern Territory all declined the ABC's request to provide us with this information, saying it's not publicly available. Now, the Australian Medical Association says that's a problem. They say there needs to be nationally consistent data so that we can see how big of a problem, how widespread of an issue this is across the entire country. Now, these public specialist outpatient clinics, they are run by the states, but they receive federal funding as part of a broader public hospital funding deal. And AMA Vice President Julian Raitt says the Commonwealth needs to step in and better resource these clinics because they're leaving too many people behind.
Clearly, we'd like to think in a society such as Australia, a so-called rich country, that we can actually deliver, a first-rate health care system. And unfortunately, Australia doesn't actually do that well in terms of equity.
Now, for this story, we spoke to Gold Coast mother Kylie Goldsborough. Kylie's son William was diagnosed with hearing loss at the age of 2, but she was told that she would likely have to wait at least 3 years to see an ear, nose and throat surgeon. She ultimately paid for him to see a private specialist. Take a listen to Kylie describing the moment after he had surgery where she realised that he could finally hear properly.
It was a life-changing moment. We hopped in the car and it was raining and he's like, "What's that noise?" And it was the pitter-patter of the rain on the car roof that he could hear for the first time.
Now, in a statement, a Federal Health Department spokesperson said the Commonwealth was investing a record amount in public hospitals and said that managing public specialist waiting lists was a matter for the states, primarily their responsibility. The states and territories have told the ABC that they're working to try to bring these waiting lists down.